In this video, I'm going to show you how to create a first visit for a maintenance patient. You'll see just how easy this is. So remember, for a maintenance patient, I define maintenance as asymptomatic and wellness, which is different than if you've got a patient who just comes to see you maybe once a month or a couple times a month, long term, more for chronic pain management. I don't consider that maintenance. For that patient, you want to create an incident that's a regular incident, and that you're going to keep track of the metrics for the pain intensity and frequency, even if they never change. That's going to keep it cleaner. The maintenance that I'm talking about here is asymptomatic wellness. They just feel fine. They just come in, want an adjustment, and so on. All right. So you've got to remember, how are you going to treat this patient? If you're going to be doing adjustments only, then you want to make sure that you document any spinal extremity restrictions that you're going to be adjusting. You want to make sure that there's a reason for that. If you're also going to be doing any muscle work, make sure you document spasm or trigger points. If it's a maintenance patient, remember, spasms are typically short-term in nature. Trigger points might be a little more sporadic and longer term. If you're going to be doing exercise on these maintenance patients, which I guess is possible, make sure you document first any painful or restricted range of motion. So here's how it works. You've logged into the program, you click on the patient's name, new incident, call it maintenance, hit save, and go to new visit. It's going to default to today's date or change the date. Click on asymptomatic maintenance on the subjective page. If there's a first visit, you can fill out all the other information too. If you're going to be adjusting them, make sure you document any restrictions, spine and or extremities in there. If there are any other findings, whether it's range of motion with pain or even spasm, trigger point kind of things, then you could document on those as well. Assessment, when you click on that, it's going to say that no symptoms were selected. Click on OK. For ICD-10 diagnoses, you could certainly use the diagnoses for segmental somatic dysfunction for each area of the spine that you plan on adjusting. If there's anything else going on, certainly you can add those. Treatment plan, click on treatment plan and spinal adjustments. The restrictions pop up automatically over there. Treatment plan and goals, you can say maybe visit frequency once a month or whatever it's going to be. Click on maintenance goals, but then uncheck the box that says short-term goals. And that's it. That's all you need to do with that. All right, so if you have any questions, feel free to email me at Dr. Greg, spelled with 2 G's at the end of Greg, at thebulletproofchiro.com.